So in my clinic, I would say, some of the more common triggers, I would say one is stress, kind of psychological stress, physical stress, huge dietary changes. I have patients that go on kind of these crash diets and all of a sudden their psoriasis flares up. But, I always point to stress as being a trigger. We also see things like infections, the strep infections, for example, are a huge trigger for psoriasis, but other types of infections too. So that's something that we look for. Dr. Patel, what other triggers do you tend to see in your clinic when you're seeing patients with genital psoriasis?
Right. So I don't know how much of this is bias because, of course, the patient is plagued with these symptoms that are horrible, that are keeping them up at night, and how much they're thinking back, what brought this upon, what triggered this,
Mhm.
versus there maybe wasn't really a trigger, but almost every time a patient with genital psoriasis can come up with a trigger.
Interesting.
Whether it be, for example, one of the photos I'll show later, the onset of sexual activity.
Hmm.
Another photo I'll show later is the I got a wax,
Right, right.
some
Yeah.
sort of contact dermatitis, bringing it on.
Or the trauma, right? Like the traumatic experience. So we talk about
Absolutely. Yes.
kevnerization and psoriasis, where,
Yes.
skin trauma can lead to the onset of psoriatic lesions. So I think the wax, potentially, even though it's very superficial, I think might be enough of a trigger in some areas, especially the sensitive areas, like you said.
Right. And sadly,
Yeah.
trauma.